Live from San Diego, this is the Fox 5 Morning News.
The Kardashians' impact on global beauty trends is undeniable, so much so that they have created a new beauty aesthetic. Board-certified plastic surgeon Dr. Vincent Marin is here to explain why such an increase in plastic surgery, especially with the millennials. Dr. Marin, good morning, and thank you for being here.
Good morning.
The Kardashian effect, really? There is such a thing now?
It's funny, they've probably had more impact on the current standard of beauty than any other, let's say, group of individuals in the last 10 years. You look at what trends were in the early 2000s, where we had skinny, tall models that didn't have any body fat, and now you have girls that are much curvier. Fuller rear end is all the rage, and I think it's almost exclusively a tribute to, initially J-Lo, but I think the Kardashians have taken that well beyond anything that J-Lo ever did.
You speak of this Kardashian effect. There's like a whole study out on the increase, especially with millennials.
Yeah.
What did that study say?
So they looked at the American Academy of Facial Plastic Surgeons, looked at their population of surgeons, and they found 66% of them are showing an increase of girls coming in under the age of 30.
Wow.
And they're coming in not necessarily for body, because we're looking at facial plastic surgeons. They're looking at facial procedures that they're coming in for. And so, yeah, this is something we really haven't seen in the past.
I just saw a picture of Kim Kardashian, and we can put her picture up recently where it showed her maybe like 10, 15 years ago, and
yeah.
then it showed her today. And do we have a picture? Are we going to show a picture? Oh, we don't have a picture of Kim Kardashian. Well, how are we going to talk about the Kardashian effect if I don't have a picture of Kim Kardashian?
We do have pictures probably of, we have a Kylie picture as well.
Okay, do we have a Kylie picture?
Yeah, there she is.
Okay, so this is Kylie.
Yeah, so Kylie, if you look at kind of where she was, and again, she's only 18 right now, which is the crazy part, but I see more in my office, and I think more and more people are coming in with wanting her lips and wanting her look, and she looks very, let's say, mature adult, and if you look at it from where she started, and the thing that gets me as a plastic surgeon is that she's coming through and saying initially that she never had any work done, and that sets up a real unrealistic expectation for most young girls who are pretty impressionable with social media and everything else that goes along with it. So,
I think you hit the target right on the nose when you talk about social media, because so many people wrapped up in the Facebook and the Instagram, and you see all of these things.
Yeah.
And it influences you.
It does, and people think that what's posted to the internet is always real and it's never been retouched or photoshopped. And I think that's the big thing with this for me, is that I feel like girls come in to see us and expect that they can achieve this, and what the Kardashians have in terms of resources and money and every surgeon available, not your average girl can afford to do that, or even is it possible with their anatomy. And I think those are hard things for us to deal with when girls come in and want something, and then you have to let them down as that but it's our responsibility to do that as well, is make sure that we don't set them up for failure.
We saw the whole lip thing with Kylie. What about the cheeks? What are millennials asking for their cheeks?
So yeah, what we used to see is that patients were coming in and trying to correct some of the things that happened when they aged. Now these millennials are actually coming in and trying to change their anatomy. So they're coming in and asking for those full, high cheekbones, and we can use fillers to create that, but everything that we're doing is at the moment temporary. And the key is I think that the moral of this is making sure that the girls realize that they're doing it for the right reason, and that you're going through, it's not going to make you have a better relationship, it's not going to make you smarter, it's not going to make your life better, or whatever that issue is. And it's important for, especially I think, this millennial generation is to understand that this is if you have an area of insecurity, it can make a difference for you, but the changing your life or making things better or fixing it is really just, it's a fantasy. And I think unfortunately it's the world we kind of live in, but the more we can educate and try to teach people, the better.
Good information. You really got to think about those things, because when you start, it's almost hard to go backwards.
It's true. It's true.
Dr. Marin, thank you for being here. 9:14, Raul, we'll get it over to you.